This video presents a technical note on the arthroscopic repair of an acute proximal detachment of the medial collateral ligament of the ankle. The patient is positioned supine, with the ankle in a slightly medial rotation and the contralateral leg in a lower level. Medial and lateral portals are established. The anterior tibial tendon is used as a skin landmark for the medial portal, and care must be taken to avoid the superficial peroneal nerve on the lateral aspect of the ankle, which is easily palpable. Now, by changing the portal, here we can identify the lesion of the medial collateral ligament in this right ankle, allowing us to pass the suture beneath the lesion. We identify the anchor site using a needle to simulate its path and establish a secondary entry point. As shown in the diagram on the right, the trocar is used to insert the anchor. At this stage, the foot can remain in plantar flexion without needing full visualization of the medial approach. We set the anchor. We first verify the anchor's secure placement on the medial malleolus. Once confirmed, a suture hook is used to capture the posterior portion of the deep bundle of the medial collateral ligament. The suture is passed from outside to inside, and the blue thread is directly threaded into the relay suture, which exits percutaneously at the point we inserted the hook. Then, we retrieve the blue suture through the anterior and medial approach, passing it over the medial portion of the medial collateral ligament rather than under the skin in order to avoid injury to the small saphenous vein. We use the knotless anchor system to minimize tissue injury and reattach the medial collateral ligament directly to the malleolus. The stability of the repair is then verified, as illustrated in the diagram. Here is the final view with the additional testing using the hook confirming the excellent grip. The suture is now ready to be trimmed. We can also perform a technical variation by doing a second pass from outside to inside, which will retrieve our blue thread to create a second pass in the medial ligament, a bit further forward to form a U-shaped configuration, which will provide the advantage of increased stability.